Welcome to Medical Coding Made Easy. In this video, we will see about musculoskeletal system. What are the bones that are forming the musculoskeletal system? And also we will see about injuries that is affecting the musculoskeletal system and also the treatment procedures that is done to correct them. So first, what is this musculoskeletal system? Musculoskeletal system means it includes muscles and bones. Muscles and bones that help us to move around, do various actions. So that makes up the musculoskeletal system. And in our human body, we have got 206 bones in an adult, and at the time of birth, the number of bones will be little higher because at the time of birth, so many bones will remain unfused, but in later life, they will become fused and become one bone. Mainly in our CPT book, we will be seeing about problems that is affecting the bones and also the treatment procedures done only for the bones. So we don't have to learn about the muscles and their names specifically, but you should know all the names of the bones in our human body. Firstly, our skeleton is divided into two types. It is called as axial skeleton and appendicular skeleton. Axial skeleton means bones that are present at the center of the body, for example, skull bone, vertebra, rib bones. All these are considered as axial skeleton bones. And bones that are attached to the axial skeleton will be called as appendicular skeleton. For example, bones in the hands, bones in the legs, all those will be considered as appendicular skeleton. Now first let us see about the bones in the skull. What are the bones that make up the skull? You can see here frontal bone, parietal bone, temporal bone and occipital bone. And also at the base of the skull we can see ethmoid bone and sphenoid bones. So all these 8 bones together make up the skull. Frontal, parietal, temporal, occipital, sphenoid and ethmoid bones. And in this picture you can see all the bones that make up the face, starting from the lower jaw, which is called as mandible, upper jawbone, which is called as maxilla, and the bones in the nose is called as nasal bones. And on the sides of the nose we have a bone called omer, and then on the sides of the cheek we have the bone called zygomatic bone, and inside the mouth, on top of the mouth we have palate, and within the orbit means the empty area in the skull where the eyeballs are present. In that area we have a bone called lacrimal bone. So like that there are so many bones in the face. Totally there are 14 facial bones. Now let us move to the backbones or the vertebra, or we can call them as spine, because the spinal cord from the brain will pass through the empty space inside the vertebra. So it can also be called as spine. In the vertebra we have so many regions. The vertebra in the neck is called as cervical vertebra. Vertebra in the chest region is called as thoracic vertebra. And vertebra that is found below the chest region, we can say in the abdominal region, that is called as lumbar vertebra. And below that we have sacrum and coccyx. So these are the regions of the vertebra. Now we will see about the number of vertebrae, or like how many vertebrae are there in our body. In the cervical region or neck region, we have 7 vertebrae, and they can be called as C1 vertebra, C2 vertebra, like that till C7 we have. So C1 to C7 vertebrae are cervical vertebrae. But to be specific, the first cervical vertebra has got a name. It is called as atlas. And the second cervical vertebra is called as axis. So these 2 vertebrae have got a specific name, atlas and axis. And these atlas and axis helps us to rotate our head in all the directions. Now we'll move to the thoracic vertebra. There we have 12 vertebra, and they can be called as T1 to T12 vertebra. So from T1 to T12 vertebra, they are all thoracic vertebra. Now we'll move down to the lumbar region. In the lumbar region we have 5 vertebrae, and they will be named as L1 to L5, L1, L2, L3, L4, L5. Just move down to the sacrum and coccyx. In sacrum and coccyx, actually at the time of birth there will be 5 bones and 4 bones in sacrum and coccyx, but later they will fuse together and become one bone. So sacrum will become one, coccyx will become one bone. So we have one sacrum and one coccyx. So totally in an adult, we have 26 vertebra, but if we count sacrum as 5 and coccyx as 4, we will be getting 33 vertebra. And in between every two vertebra, there is a structure called as intervertebral disc. And according to our book, they use so many terms for the intervertebral disc. It will be called as interspace, gap, and levels. And every single vertebra will be called as vertebral segment. So when you are reporting procedures on the vertebra or in the spinal cord, you have to check whether it is done in a vertebral segment or it is done in an interspace, intervertebral disc, or in the gap or levels. Next is we will see about bones in the chest. In the chest, we have a bone that is like lying horizontally, which is called as clavicle, and it has got other name as beauty bone or collar bone. And after the clavicle, at the center of the chest, there is a triangular flat bone which is called as sternum. And on either side of the sternum, you can find 12 rib bones that are attached to the sternum at the front and they are attached to the vertebra at the back. So these are the bones that are found in the chest region. Now we will move to the back of the body where we have in the shoulder region, we have a bone called scapula. It is a big flat bone which is triangular in shape, which is forming the shoulder blade. You can see so many other bones that are coming and joining with the scapula, like clavicle is there, humerus, which is the bone in the upper arm. All these are joining together with the scapula and making up the shoulder joint. As you can see in this picture, the joints are named as glenohumeral joint because the glenoid part of the scapula and the humerus bone are meeting at that area. And we have acromioclavicular joint, that is also a part of the shoulder joint where the clavicle and also the acromion portion of the scapula will come and meet. So these are the things that make up the shoulder joint. And also you can see one joint at the front which is called as sternoclavicular joint, which is a joint between the sternum, that is the chest bone, and also the clavicle. So like that, there are so many joints in this shoulder region. Next is we will see about bones in the pelvis region, that is in the hip region. There you can see ilium, then you can see acetabulum, then at the bottom of the pelvis bone you can see ischium, and still below that you can see a part called as pubis, and at the center of the pelvic bone there is a part called pubic symphysis. All these are parts of the pelvic bones. And also at the back of the pelvis we have the sacrum and the coccyx. And in this picture you can see the difference between male and female pelvis. Usually the opening in the pelvic bone will be little bigger in females to allow the delivery and all. So the gap between the bones will be little bigger than the male pelvis. And also this acetabulum is a part of the hip joint which will join with the femur bone from below. That means from the thigh region, the femur bone will come and join in this acetabulum region. This acetabulum is a socket-like part of the pelvic bone, and that is the region where the head of the femur bone will come and join. So this joint is actually a ball and socket joint. Both hip joint and shoulder joints are called as ball and socket, and also both these joints can be moved in all the directions. You can rotate your hand, you can rotate your thigh region. So this ball and socket joints will help us to rotate those parts. Now let us move to the bones in the upper extremity. In the upper extremity after the shoulder, we have the bone called as humerus, which is a long bone which is present in the upper arm region. And the upper end of humerus is making up the shoulder joint. Lower end of the humerus is making up the elbow joint. So we can say that as proximal end of humerus is forming the shoulder joint, distal end of the humerus is forming the elbow joint. Now we will just go below that. In the forearm region, that means below the elbow joint, we have two bones, ulna and radius. And here in the exam they will ask you a question, which bone is found in the outer aspect of forearm? It is nothing but the radius. This is a very important question. You should remember this. Radius is present in the outer aspect of forearm, and ulna is present in the inner aspect of the forearm, and it can be said in other terms also. Radius is present distally and ulna is present medially. So humerus bone and also this ulna and radius from the forearm region together make up the elbow joint. And elbow joint is actually a hinge joint. Hinge joint means you can move it in only one direction, like a door. So you can just fold your hands inside, but you cannot like take your hand backwards. So that is the movement that is possible with the elbow joint. And the movements that is possible with the elbow joint are called as flexion and extension. If we fold the hands inwards, it is called flexion. If you fold the hands outwards, like when you stretch the hand, that is called as extension. So now we will move further down. Below the radius and ulna, we have 8 carpal bones. These carpal bones will look like small pebbles actually. They are very small and short bones which are arranged in 2 rows in the wrist region. So here the radius and ulna, the lower end of the radius and ulna and the carpal bones together make up the wrist joint. And this type of joint is called as gliding joint. So the gliding joint will help us to rotate and also move the wrist in all the directions. And after that, below the carpal bones, in the hand region, that means in the palm region, we have 5 metacarpal bones. Those are slender, long bones which are present in the palm region or hand region. So there are 5 metacarpals according to the number of fingers. And after the metacarpals, we have phalanges. Phalanges are bones in the fingers, and there are 3 phalanges in all the fingers except thumb finger. Thumb finger has got only 2 phalanges. All the other fingers have got 3 phalanges, and the name of the phalanges are proximal phalanx, mid phalanx and distal phalanx. But in the thumb, we don't have the mid phalanx. We have only proximal and distal. And the joints between metacarpals and phalanges are called as metacarpophalangeal joint. And the joint between phalanges bones are called as phalangeal or interphalangeal joints. So here in the fingers, totally we have 14 phalanges. 14 phalanges are there in our fingers. Now let us move to the lower extremity, where in the thigh region we have the longest and strongest bone in our body, which is called as the femur. And the head of femur is making up the hip joint. Joining with the acetabulum, it creates the hip joint, and as I told you before, it is a ball and socket joint. Now we will move down to the lower end of the femur. The lower end of the femur and also bones from below makes up the knee joint. So what are the bones that are making up the knee joint? The lower end of femur, patella, and also we have tibia and fibula. Both these bones in the leg also will make up the knee joint. So 4 bones will make up the knee joint. Lower end of femur, upper end of tibia and fibula, and also the patella together makes up the knee joint. So now we will move down to the leg region. In the leg we have tibia and fibula bones. Tibia is thicker than fibula, and tibia is present in the inner aspect of the leg. Fibula is present in the outer aspect of the leg. And now we will go down below that. And when you still go down, in the ankle region we have 7 tarsal bones. 7 tarsal bones. So tarsal bones and the lower end of tibia and fibula together make the ankle joint. So now we will go further down to the foot region. In the foot region we have 5 metatarsals and 14 phalanges in all the toes, same like fingers. Great toes have got 2 phalanges and all the other toes have got 3 phalanges each. So totally there are 14 phalanges. Same like the hand, here also we have metacarpophalangeal joint and interphalangeal joints. So these are the names of the bones in our body, and also I have almost covered all the joint names also. So now let us move to the problems that can happen to the bones. Common problem that can affect the bones due to injury is fracture. Fracture means breakage of the bones or broken bones. But according to our CPT book, you should know a small classification, how we will classify the fractures. The first classification will tell you about open and closed fractures. First we will see about closed fractures. Closed fractures means there won't be any involvement of skin, but the bone will be broken and you cannot see the broken bone outside. That is a closed fracture. But if there is involvement of skin, that means damage to the skin is there, and through that damage you can see the broken bone. So that type of fracture is called as open fracture. This is first classification. And the next classification will be called as displaced and non-displaced fractures. After the fracture, if the pieces of broken bones are remaining in the same place, there is no displacement, then we can call it as a non-displaced fracture. But after the fracture, if the broken bones have got separated, there is a gap between them, or they have moved away from each other, there is a slippage of the bones from their own place. So that is called as displaced fracture. So if the bones are staying in place, there is no gap between them, we can call it as non-displaced. But if there is a displacement of the bone after the fracture, it will be called as displaced fractures. And the next problem which can affect the bones and joints due to injuries is dislocation. Here there won't be any fracture, but the bones in the joint region will get dislocated or displaced. So they are not in their original place. So the bones will just slip out of their place. That is called as dislocation. For example, you can see here shoulder dislocation. If the shoulder bone has come out at the front, it can be called as anterior dislocation. And if it goes back, it will be called as posterior dislocation. So fractures and dislocations are the common problems that can happen to the musculoskeletal system due to injuries. So in our book, we mainly concentrate on treatments of fractures and dislocations. So now let us move to the guidelines that is given in our CPT book. Firstly, you can see that all services that appear in the musculoskeletal system section include the application and removal of the first cast, splint or traction device when performed. So whenever a surgical procedure is done for musculoskeletal system, the application of first cast, splint and traction device is included in the procedure, and also removal of it is also included in the procedure. So if the same doctor is doing everything, you don't have to charge the patient when the patient is coming for removal. But you can report the supply separately with HCPCS codes. And if the casting is removed by someone else other than the treating physician, then you have to report the removal codes. So that is the first guideline. Next one is the second paragraph says that subsequent replacement of cast, splint or strapping or traction device during or after the global period may be reported separately. So when a patient is coming for a second casting, after removing the primary cast, you are going to provide a secondary cast. Or we are removing the secondary cast, again giving a third one. In such a case, you need separate codes for them. Now read the third paragraph. A cast, splint or strapping is not considered part of the preoperative care. Therefore, the use of modifier 56 for preoperative management only is not applicable. So before doing a surgery, if they give cast, splint or strapping, you cannot consider it as a preoperative service. It has to be reported separately. The last guideline says that codes for obtaining autogenous bone grafts, cartilage, tendon, fascia lata grafts or other tissues through separate incisions are to be used only when the graft is not already listed as part of the basic procedure. So in a surgical procedure, they mentioned that they are using a graft. It can be a cartilaginous graft, tendon graft or a fascia lata graft. But if it is not included in the procedure, then you have to report it separately with the help of separate codes. Next is we will see about treatment of fractures and dislocations. So now you know what is a fracture and dislocation. Fracture means broken bones. Dislocation means displaced joints. So now how we treat them? We treat them by different methods. Open method, closed method and percutaneous method. But the simple treatment is casting. This is a simple treatment that is done for fractures. And this is splinting. They use some support system. In addition to the casting, they will fix something near the bones so that the bones doesn't move after the casting. So it will provide a support to the fractured bone. It will hold the bones in the same place. So now we will read about the treatment procedures that are used for fracture or dislocation treatment. First thing is manipulation. Manipulation means reduction of bones by application of manually applied forces or traction to achieve satisfactory alignment of the fracture or dislocation. So the fractured bone has got dislocated. How we are going to realign it? How we are going to put it back in its place? That is done with reduction, and that reduction can also be called as manipulation. And this reduction is divided into closed reduction and open reduction. Closed reduction means doctor will not do any surgery, but he will apply some finger pressure or hand pressure to move the bone back to its place. And also they can use traction devices to put the bones back into their place. But if it is an open reduction, they will do a surgery, put the bones back in their place, and also they will do internal fixation in addition to open reduction. That means putting screws, plates and rods near the bone itself. That is open reduction and internal fixation. So these are the methods of reductions. There is another simple method of treating the fractures is external fixation. That means we will put plates, rods and screws outside the bone, and it will be usually present outside the skin. So it is actually called as a percutaneous fixation or external fixation. So in this picture you can see that how rods and plates or metal things are put around the fractured area, and that can be classified into two types. One is uniplanar external fixation. That means the screws and rods will be placed in one direction. But if the screws and rods are placed in multiple directions around the fractured area, it will be called as multiplanar external fixation. So these are the things we do to treat a fracture. And after the definitions of fracture treatment, you can see about excision or resection of soft tissue tumors definitions. If we are going to remove a tumor from the soft tissue, if it is at the level of subcutaneous level, that means the tumor is present below the skin but just above the muscle. So it is subcutaneous. So if we are going to remove such lesions, what are the things we have to look? We have to look into the size of the tumor and where it is located. So all these things will help you to identify the codes. And also, whenever a tumor is removed from the musculoskeletal system, after removal, the doctor will be doing the repair. Simple and intermediate type of repairs are included in all musculoskeletal system procedures. So note that down. Simple and intermediate repairs are included in all musculoskeletal excision procedures. And the next level will be excision of facial or subfacial tumors. That means the tumor is found below the skin but outside the muscle. Around the muscle we have a covering called as fascia. So if there is a tumor there, it is called a subfacial tumor or intramuscular tumor. Intramuscular tumor, that means the tumor is within the muscle layer. We can call it as intramuscular. Mostly they will be benign type of tumors only, non-cancerous. So here also you have to check the size of the tumor and also the location of the tumor, and remember that simple and intermediate repairs are included in these procedures. Till now we saw about just simple excision, but now we are moving to radical resection. Whenever they use the term radical means it is an extensive removal of tumors. If there is a aggressive tumor, that means the tumor is like very big and it is spreading fastly, we will remove it with the surrounding structures. So whenever we are removing not only the tumor but some amount of normal tissue in addition to the tumor, it will be called as radical resection. So if a radical resection is done in the soft tissue or in the soft connective tissue, again you have to check the diameter of the lesion and also the location of the lesion. And if it is a bone tumor, again you have to check in which bone they are doing it and what is the size of the tumor removed. And also note that here also the intermediate and simple repairs are included. And remember that always a radical removal or radical resection will be done for malignant tumors, and also it will be done for aggressive benign tumors. So these are the guidelines that has been given under the musculoskeletal system. If you are very clear about this, then the coding will be very simple in this chapter. So you should know about different types of fractures, different types of treatment options available, and also you should know about each and every bone in our body. where it is located, what is the name of it. If you know all these things, then this chapter will be very simple. So that's all about musculoskeletal system. If you have any doubts in this chapter, just drop in a comment. I'm ready to answer your doubts. Thank you. Thanks for watching, and please do subscribe my channel. Thank you.